Hi and good day. Millions of people suffering with chronic neck problems. And unfortunately, many of these people never really realize or understand the underlying source or underlying cause of that condition. Particularly that if someone's having pain radiating down in the arm, is the problem coming from the neck? Could it be coming from the elbow, the wrist? Where is the pain coming from? So I want to give you an understanding a little bit about specific diagnoses and little things that we can do to check or test or diagnose exactly the proper way to know where the causation is stemming from. There's nothing worse than treating a symptom and not knowing where the problem is coming from, because therefore the condition can continue to get worse, and obviously without you even knowing it. Very common condition is cervical radiculopathy. They use neuropathy, radiculopathy, neuritis, inflammation of a nerve, basically coming from a disc, a bulging disc or herniated disc, affecting the nerve root that stems out of the neck, that makes its way down the shoulder, into the arm, to the hand, and even to the fingers. You can get tingling, numbness, cramping, aching, but those nerves that actually come out of there can go into the chest as well, inside the shoulder blade. The issue here is that where is the problem stemming from? Very commonly through incorrect posture, forward head posture, pronated shoulders, as well as incorrect ergonomics, over accumulation of time, we then get degeneration of the discs as well as the vertebral joints in the spine, particularly within the neck/cervical region. The cervical spine is made up of 7 vertebrae, and in between are the discs, and you have nerves that come out in pairs on both sides. Wherever that nerve is becoming inflamed and irritated is generally the source of where you're going to feel pain or inflammation, or pain traveling down that specific nerve. Quite commonly, we lose the cervical lordotic curve as a result of incorrect postural positioning. Forward head posture, rounded shoulders causes deformation and changes of the vertebral segments, causing the imbalance to occur where you get a straightening or a kyphotic or reversal of that cervical curve. The discs then start to degenerate rapidly. The nerves become inflamed and irritated. When we take the head and we lean it back over that site of compression, the pain will usually get worse. We can replicate the pain, which may actually cause burning, tingling, numbness to where that nerve pattern is going to. Nerves affect different parts of the arms and hands. That's how we diagnose where the nerve is coming from. We can actually use reflexes as well as motor strength checking the muscles. But these nerves in the neck go inside the shoulder blade, they go into the chest. In one person, you may feel pain in the shoulder blade, and another person down the chest, and in the other person down the arm into the hand and fingers. Very seldom will get compression coming from the shoulder joint. The next joint would be the elbow. The most common area would be the ulnar nerve. That nerve, when compressed and irritated, generally will cause numbness and tingling and paresthesia, generally affecting the C8 nerve root. That's the last 2 fingers of our hand. The next most common condition is carpal tunnel syndrome. The nerves then have to make its way through the wrist, into the hands, into the fingers. The way we check for carpal tunnel syndrome is called Phelan's test. If we take your hands and put them back to back, like this, with the back of your hands against each other, and hold it there, you'll notice that maybe after 20, 30, 40 seconds, you'll start getting numbness or cramping or tingling into the hands, predominantly the first 2 or 3 fingers. Another way we can determine that, we can take a reflex hammer, you can take your fingers and you can hit it right over the median area where the median nerve comes through in the carpal region, and you'll feel a real sharp burning, radiating pain if that median nerve is compressed and irritated. Carpal tunnel generally is from accumulation of typing, repetitive motion of the hands, fingers. People that sew a lot, people that do a lot of laborious work with their hands repetitively can inflame that carpal tunnel region. The most important thing I want you to gain from this is proper diagnosis. Treating a condition with Advil, Motrin, ibuprofen, naproxen, or other anti-inflammatories without knowing the root of where it's stemming from is not only wasting time, but doing damage to the liver as well as the kidneys. I hope that this explanation gives you a better understanding about the nerves and how they function and work within your body. Most important, if you have questions, you can send them over. Put your comments below. I ask you to please share this video because you could be helping many others. Make it a great day. I'm Dr. Alan Mandell.